Good morning. It's Ronnie Yoga Devi coming to you from my home in Leamington. And it's Sunday. I just got home from church and then going out for a nice brunch. Love that with my parents. It was great. I am making a video to talk about what you do when you have back pain. The first thing you want to do when you have back pain, even before you get to the chiropractor, if you have access to a chiropractor, is to take one knee, lay on your back, on your bed, because if your back is bothering you, you probably can't get down to the floor. You're going to take one knee and bring it right into your chest, laying on your back, so you're relaxed back, and the leg is just, the gravity will bring your leg in towards your chest and abdomen as much as your body can allow. And you just let it rest there and you focus on abdominal breathing. So as you abdominal breathe, I'm going to pretend I'm laying down. As you're abdominal breathing, your shoulders and your arms are relaxed. Your eyes are closed. You're going to take a nice deep breath in. As you breathe into the abdomen, it pushes your leg away. As you exhale, the knee comes towards you. You can inhale through the nose and exhale through the nose. Or if it feels better to release more tension, inhale through the nose and exhale through the mouth, and exhale until all the air is out, and then continue. So you do that with the right leg first and then the left leg. And then you bring both knees into your chest and do the same thing. That releases the back line of your back. That will help any exercise that you might do and any postural adjustments. The next thing you have to be very conscious of is to make sure that, I think I can get in here, that your pelvis is properly aligned. You see that if I am here, my back is in a neutral position right now. And if I let go, then my lower back is more arched. And when my lower back is more arched, this is sticking out more. If I tuck my tailbone under, I still got a little bit of a belly, but it's not sticking out as much. So it makes a very big difference. So from the front, you can see that as well from the front. There's a difference that you can see, and this is kind of a funny view of me, but it is an important view to understand what's happening here. And then you want to think, here's my hips, and you want to think about your hips and your rib cage. So my rib cage is here, here's my hips. You want to make sure they're aligned. So sometimes you got to bring back or bring forward, depending on what's happening with you. So sometimes all you need to do is bring your ribs back and this will align. You notice that happened with me. See, if I put my ribs forward, you can see that this is all coming more forward. If I bring my ribs back, it automatically will align everything in here. And that is really very important. If you've got back pain, the first thing you want to check is, how's my posture? Is my spine, get back down here, is my spine erect, nice and tall? And you do that by imagining you've got a little thread attached to the crown of your head and someone is pulling you upward. And then you're dropping your shoulders, relaxing, making sure the ribs to hips are aligned and your ribs are pulled back and your pelvis is tucked under. Usually just by bringing the ribs back, that will happen. One of the things you can do that my chiropractor actually taught me many, many years ago is to sit on a chair backwards. So sit on the chair with the back this way and you put one leg on one side and one leg on the other and you sit in that chair backwards. So your legs are open. Your legs are open, feet flat on the floor. If you can't get your feet flat on the floor, put pillows underneath of your feet so you can get that and just let yourself sit. And that takes a lot of pressure off of your lower back and helps to align the pelvis, because if it's pelvic in alignment, that can cause a different type of pain. Then there's the sciatic stuff. A lot of people have a sciatic nerve problem, and I'll have to stand up again for this one. So if you've got a sciatic nerve issue, that can run down the back and down the leg, but it can also run down the back and through the inner thigh. So there's two different ways you can end up feeling that. So with a sciatic issue that is causing something in the inner thigh, it's possible that what you've got going on is these muscles and these muscles, which are the ones that help the front of the body to engage. You need to engage the front of the body and the back of the body. So you need to engage these muscles in the back here, and you also need to engage your abdomen. Normally that will happen as soon as you pull this back. But if you consciously think about pulling this in and pulling this in as well, it will help. And then you're going to do this. I'm going to put 1 foot forward and 1 foot back. So I'm in a little bit of a lunge. This leg is forward and bent. The back leg is straight. And I will demonstrate this further in another video so you can see my full body. So I'm going to tuck this under here. And when I tuck this under, where I'm going to feel the stretch is the straight leg in behind. So if I want a bigger stretch, I bend the knee forward more, and that increases that stretch. And this stretch in the front of the leg is what my friend's husband needs, because that's where he's feeling the pain. And if you have trouble balancing, you want to hold onto the side of a chair. I just put my hand on my computer. Hold onto the side of a chair or something. You only really need enough support, so that's like even just 2 fingers of support is enough to help you with that. This is the side that gets tight for me, and you can feel this all the way across the front of the leg and right up into here when you feel that stretch, because it gets all of the muscles that flex the front of the body. They contract in the front, and that's what causes that tightness. It literally is doing this. The muscles are shortening. What you want to do is lengthen them. That's why yoga is so helpful, because it lengthens the muscles and it creates a slimmer, longer muscle. And that is prettier than a big muscle. And if you're a larger bone person, a bigger muscle from working out with weights will make you appear bigger initially until you start to have balance in the muscles. And if you are trying to lose weight, what happens when you build your muscle is that the muscle gets stronger and it's pushing out. But if you've got a little bit of a layer of fat, which I do, and many of us do, you are pushing that out as well. So don't worry if it looks as though you are getting bigger, because you are getting bigger. But as you're getting bigger, what's happening in the metabolism of your body is it is breaking down all of that. It's slowly breaking down the fat, but it doesn't happen overnight. So be patient and keep doing what you're doing, whatever it is with your diet and your exercise and your yoga. Keep doing it. That's really important. And that is the main thing on a physical level. But if you can't do that, there are things that we can do from yoga and from Ayurveda and from reflexology that can help. So yoga and Ayurveda, your thumbs, and reflexology too, one style of reflexology, your thumb right here represents your spine. So it's mostly right here. So you can massage this area and you will feel it. The spine runs all the way along here. You will feel where the spine reflexes are. You can run all the way from the base right up the thumb I should say. And you can also pull gently on that thumb, not too hard, but I'm applying enough pressure that I can really feel it lengthening, and that lengthens the spine. And you could do the same thing on the other side. Massage. You feel it. It's very tender. I have a need to get to my chiropractor as well. Not painful right now, but the other day, one side of my back was bothering me, so I had to do all these things. So you pull that. And then the thing that comes from yoga and Ayurveda, making a gentle fist So you're not strong. It's just loose. It's not like I'm squeezing anything. It's the hands are loose. And you bring your thumbs right up towards the ceiling. And as you bring your thumbs up towards the ceiling, you'll notice I've got some polish on one nail and not on the other. Notice the difference between the two thumbs. One curls back a little bit more. So you want it to lengthen up as much as possible. Don't worry about the curling because it's very difficult to get it straight. So imagine that the tips of your fingers are reaching up towards the ceiling, and then you're going to just let those hands rest. Rest on your legs, wherever your hands fall, so that your shoulders are still in a nice relaxed position and your elbows are bent. And just let yourself close your eyes. You may feel something in the upper back, around the shoulder blades, in the neck, and the shoulders. Allow yourself to just focus on those areas and breathe energy into them. And this time, you don't want to breathe into your abdomen. You want to breathe into your chest. Let your chest expand. And sometimes you can breathe into the clavicular region, which is right here. This is your clavicle bone right here. So you can also breathe into that clavicular region. And when you do that, it looks a little different. It's like this. Across here is very tight. Right here, I feel it. Sometimes I feel it more on my neck. Very important to deal with that. As I'm doing this, I really feel the thumb on the side where my back is got some pressure, where it's working really hard. Not necessarily where the problem is, but where it's working very hard. You can feel the thumb as you're holding it up like this. Sorry, I'll try to get it in there. You can feel the thumb starting to go when it starts to get tired. So you be very aware of this. Try to keep it up. And when it goes down a little bit, just keep it up. Keep it up nice and strong. And that will help your back an awful lot. An awful lot. Another thing that helps your back is to simply sit forward on your chair. As a person who's a little bit on the short side, I have to do that all the time because most chairs are far too big for me. And so I sit a little bit forward in my chair when I'm somewhere like a restaurant, like I was a little while ago today. I even do the same thing at church. At church, I also have an extra like a pillow, because the pews at the church are wooden. I have a pillow underneath of me and then a pillow behind me, so that when I am able to sit right back, I can actually sit right back, because just half an inch or an inch can sometimes make a difference for a person who's a little bit shorter. And you know how as we get older, we get shorter too, because we lose length in our spine. Well, that's partly because of this, that we're not as conscious of what's happening with our spine, and our spine starts to bend. Nutrients are also really important, getting the right minerals into your body, calcium, magnesium, the right vitamins, vitamin D and C. Very important. And there's a host of others, but do your research and find out what nutrients you need. I actually get something called it's from a company called New Roots Herbal, and it is a bone health supplement, and it's fantastic. It's got calcium, magnesium, everything I need in there, and I will include that either in the notes, or if I forget, somebody asked me. I'm in a bit of a rush now because my boyfriend's going to be coming to pick me up any minute now, so I've got to put this through to YouTube to be approved, and before it goes through, and put all my notes and stuff. In any case, that's like for my friend's husband, and anybody else who has lower back problems, and anybody else who has sciatic issues. You can also go through the videos. There are a series that I did for my cousin Terry Lee back in the day when she was having problems with her sciatic. nerve area. She was having really bad sciatica, and I think it was in the middle of COVID, so nobody could visit each other and do this. So I did that video at that time. It was if you look at my YouTube, it's all should be all organized, most of it into sections, and they've taken that away. But most of the capacity to organize things in groups, we can't do that anymore. But the things that I have done in the past, there is a whole section on back and sciatica and a whole bunch of stuff. And if you can't find it, let me know, because I'm happy to send it to you. So please feel free to leave comments on the video, leave questions on the video. There's a few people who've taken advantage of that, and I appreciate that, because then I know that somebody's using this knowledge, because knowledge is nothing if you don't pass it on and it doesn't get used. So it's helpful for me to have it. It's helpful for me to pass it on to my students. It's helpful for me to pass it on to my friends and to my family and my boyfriend and all that. But I'd like to pass it on to a larger audience who doesn't have access to somebody who has my skills and my knowledge. So that's about all for now. Rani Yoga Devi signing off. Happy Sunday. Enjoy the last of your weekend, and stay safe out there. Bye for now.